Hi everyone, my name is Santina. I am a board certified physician assistant specializing in plastic surgery. And today I just want to go over a few most commonly asked questions from my patients that I receive all the time, just to help with any confusion or, maybe you have the same questions or concerns for your surgeon or your PA that I can be helpful with. So the first question that I typically always get is my breast infected? Do I have a little pustule there? Looks like a pimple. It's super painful. What do I do? Do I need antibiotics? Do I need to go to the hospital? So typically for this, whenever you have surgery, the body weeks to months later even can start rejecting the suture. So you can either get something that we call a spitting suture, where you typically sometimes don't see it, but it's super painful. So if you run your finger just over that area, you just kind of want to jump out of your body. It's so painful. Sometimes you do get a small little pustule that can look like an infection or a pimple. And what you'll do in that scenario, I always tell patients, it's a suture cyst or a suture abscess. Most times a suture cyst. And what you can do is just put a warm compress over the area, and 9 times out of 10 it will just express itself and heal on its own. You could apply Aquaphor after just to help with any healing afterwards. As far as the spitting suture goes, that's a bit different. Most times you'll have to be seen in office to get that kind of clipped out. And then as soon as it's clipped, it's super painful when it happens, but it's 1 second. And then after that, you feel amazing and everything heals up just fine. So I just want to remind everyone of most common signs and symptoms of infection after any surgery. So obviously fever, redness to the surgical site, any increased pain, swelling, all of that stuff, any drainage, any purulent drainage that you may see. And then obviously just call your surgeon or the office and have them get you in immediately. But a suture cyst and suture abscess and also a spitting suture are not infections of the breast. And sometimes they may even drain. And sometimes it may be a yellowish, greenish, whitish drainage. And that is not infection. That's just your body expressing what it needs to out of that area to try and release that suture from that area. Please let me know if you guys have any other questions, and I'll be continuing this series moving forward just to kind of answer any most common questions that patients have about plastic surgery. Thank you.